So now, Alexandra Vrazo is going to present a multi-country analysis of the impact of COVID-19 on HIV services for pregnant and breastfeeding women and their infants. Doing this for USAID.
My name is Alexandra Vrazo, and today I will be presenting Abstract 22, a multi-country analysis of the impact of COVID-19 on HIV services for pregnant and breastfeeding women and their infants. On behalf of our team at the Office of HIV/AIDS at USAID, I'd like to thank the International Workshop on HIV Pediatrics, as well as the conference coordinators for the opportunity to present. We have nothing to disclose. Ensuring access to HIV services is crucial for pregnant and breastfeeding women and their infants during the COVID-19 pandemic. These essential HIV services comprise PMTCT programs, including maternal HIV counseling and testing at both antenatal and postpartum settings, ART for the mother, and regular monitoring of her viral load during pregnancy and breastfeeding. For the infant, these PMTCT services include prophylactic ARVs, as well as access to timely infant virological testing. Since March 2020, countries supported by PEPFAR through USAID have adapted interventions to ensure continued access to HIV clinical services for pregnant and breastfeeding women and their infants during the COVID-19 pandemic. We wanted to understand, what has the impact of COVID-19 been on the USAID PEPFAR PMTCT program, and also what can we learn about service delivery to inform future directions? So the objective of this work was to quantify differences between time periods to understand any impact of COVID-19 on PMTCT programs. The data source was USAID PEPFAR MER data from 11 countries, and the measures were pregnant women tested for HIV and those receiving ART, as well as HIV-exposed infants tested by 2 and 12 months of age. The analyses performed included a comparison of reporting periods before and during the COVID-19 pandemic, which we define as Q2 and Q3 of FY20, respectively. Knowing that we see increases and decreases in the number of sites supported by USAID, and therefore the number of beneficiaries reached from one fiscal year to the next, we wanted to also compare this data with the same time period in the previous fiscal year 19. We also analyzed trends over time for PMTCT data. The 11 countries selected for this multi-country analysis had significant USAID PMTCT programs, and so the following data is shown in aggregate from these 11 countries. Looking at HIV testing in pregnancy, we found that the overall number of women counseled and tested for HIV at their first ANC visit decreased by 8% between Q2 and Q3, as shown by the blue line. This was a slightly larger decrease when compared to the same time period in FY19 of 3%. On the right, we reviewed the trend in HIV testing coverage at ANC1 and found no significant decrease between Q2 and Q3 of FY20. Looking at the new HIV diagnoses made among pregnant women, we found a 9% decrease in the absolute number of pregnant women living with HIV who were identified in Q3 compared with the previous quarter, as shown in the blue line. This was a slightly larger decrease compared with the previous fiscal year of 6%. On the right, we reviewed the trend in positivity rate at ANC1 and found no significant decrease between Q2 and Q3 of FY20. Taken together with the data on the previous slide, this suggests that while the COVID-19 pandemic may have decreased overall the number of women entering ANC, it did not necessarily impact the provision of HIV testing and counseling services or case finding through the ANC platform. Regarding ART for pregnant women, we observed an 8% decrease in the number of pregnant women receiving ART during COVID-19 in Q3. However, this decrease was also similar compared to the previous fiscal year comparison of 8% versus 7%. On the right, trend data for ART coverage for pregnant women indicates that pregnant women received ART at the same rate in Q3 compared to Q2. As a quick note, ART coverage over 100% may indicate women who have been diagnosed with HIV outside of USAID-supported sites, but later entered USAID-supported sites to receive ART. Therefore, these women would have been reported in the numerator, but not in the denominator used in the coverage calculation. Looking at whether COVID-19 impacted virological testing for HIV-exposed infants at USAID sites, we found that the number of infants tested by 2 and 12 months of age decreased during Q3 compared to the prior fiscal year, where we saw an increase during this time period. Increasing the testing of HIV-exposed infants by 2 months of age is a priority for PEPFAR PMTCT programs. So on the right-hand side, we assessed whether COVID-19 had impacted testing coverage. However, we found this to not be the case. There was no major difference between Q3 in terms of the coverage of infant testing by 2 months of age compared with Q2. So in summary, women and infants have continued to seek PMTCT services during the start of the COVID-19 pandemic, despite some modest decreases across the cascade. These modest decreases may suggest potential missed opportunities for HIV diagnosis for mothers and infants, and we are following up closely with the country teams to assess whether catch-up campaigns are needed. So despite these small decreases in the absolute number of mothers and infants accessing services, the maintenance of ANC testing rates, maternal case finding, ART coverage, and infant virological testing coverage suggests that PMTCT services were still able to be provided at USAID-supported sites across the 11 countries studied in the context of COVID-19. So our recommendations are that during COVID-19, adapting PMTCT services to reach mothers and infants are crucial. Further adaptations to increase infant testing coverage may be needed, such as catch-up campaigns for infant testing, or SMS or telehealth consults by providers or peer mothers to support postpartum mothers on dosages and appointment scheduling. Countries may also consider community-based DBS sample collection to minimize the need for mothers and infants to attend facilities. With that, this concludes the presentation. I'd like to thank you so much for listening.